Hi, I'm Hannah. I'm a physio. I work in Canmore, Alberta, and I'm just going to chat about ACL rehab and ORCA. As a physio, working at ORCA and going through the ACL rehab, it was a bit different than other clinics that I've worked at previously. Following along in the research, we know that ACL rehab does take a bit more of that time and that effort, making sure that we hit all of those targets to make sure that the rehab goes where we want it to. And ORCA has done that really well. So the systems and the frameworks are something that I was trying to develop on my own, but coming to ORCA really helped me solidify those and make sure that all my athletes and all my patients were hitting their milestones before moving on to the next phase of rehab. The other thing that ORCA did really well is all us physios, we can do that acute sort of rehab, but again, having that system and that framework made it really clear cut where the athlete needs to be in that acute phase. And then knowing that we have those systems to move forward in the rehab phases, we were able to flow into more of the training, the S&C, and those principles that actually take an athlete back to their sport. Or if it's just an activity as well, if they're just going back to live their lives, they still need to make sure that we can try and reduce any risk of injury moving forwards. Implementing the systems and the frameworks into my own practice takes a little bit of time because you do need to figure out how you're going to talk to the patient about it, how you're going to fit that into your sessions. Again, having those frameworks, it does give you a structure for each session. Working where I am now, I don't have all the same technology that ORCA did have, which makes testing objectively really easy. But having, again, those frameworks, I was able to take the pieces from what I knew was important for each phase of the rehab and then develop my own framework that would use slightly less amount of technology, but still making sure the athletes had those pieces that they could hit and make sure that I wasn't skipping things just because I didn't have all the technology available to me. There are a lot of things and a lot of ways that you can do it, whichever clinic that you are at and whatever you have available. So having those frameworks and then knowing which steps to take will really help you to develop your own frameworks moving forward. Getting into the rehab space as a physio, you do have to think a little bit more about how much time and how much effort you are going to be putting into each session. You do need to prep a little bit more. You definitely need to stay on top of that research, and then you need to apply it to your practice as well. So having ORCA, again, give you those base blocks and that framework will really set you up to then take that into your own practice. But just making sure that you know that the athlete's going through an injury like an ACL is quite taxing physically, mentally, emotionally. And so you're probably going to be the person who sees the most. And so you do need to be prepared for that kind of treatment with those patients. Getting into ACL rehab specifically also really does require the specific training for ACLs. So again, it's not just like your normal injuries, it does take a little bit more of that time and effort. And so just making sure that you have that training, making sure that you know the key points that those athletes need to hit, and then how you're going to apply them in your practice. So prior to working here, I had reached out to ORCA, to Taylor and Travis. They were both really receptive and about talking about how ORCA can provide that space for athletes. So I chatted to them on that side of things. When I had tore my own ACL, Travis was there right away and basically kind of was a guide in the first couple steps that I needed to take. Then I ended up being the patient here and going through my own ACL rehab, but then being a physio here, Travis has always been able to take a little bit extra time and explain everything. Even though, again, being a physio, I know a little bit more maybe than the general patient, still takes the time to explain all of the outcomes to me, all of the numbers that I'm hitting, reasons why I might not be, and I have seen him do that with all of his other patients as well. After moving on from ORCA and working in Canmore, Travis has always been very available, so I'm able to shoot him a text, mostly about ACL clients, but sometimes other little things as well, because I know that he's always up to date on the research and he's super receptive to people asking questions. There's never any judgment in those questions, and again, he just fully explains it, takes the time, runs through, makes sure that you have had all your questions answered, and then you know the next best steps for your patients. Having taken all of that information, the frameworks, the systems, the step-by-step, I've really been able to implement that in my own practice now, and getting all of that information from ORCA really gave me the confidence to help my patients move forward, especially into that rehab phase after the acute and going back to sport.